Hi, my name is Catherine Murphy, and this is my clinical reflection for Nursing 335, and I'm going to be going over the 8 course objectives. The first objective is to apply knowledge from previous courses in the physical and social sciences, humanities, and nursing, and meet the multidimensional needs of individuals and groups within the local geographic area. So, this objective was met with my peer leadership hours. I signed up to do sim lab, and I did a day at a clinical site with the accelerated class for 421. So at the clinical site, I helped the students with their head to toe assessments. I made sure that they did their assessments correctly, and I also helped to prepare them for their med pass that they were doing with their clinical instructor that day. So I would ask them questions such as, what med are you giving? Why are you giving it? Any contraindications, side effects, and how are you giving the medication to the patient? And I did this because when I took 321, my clinical instructor asked me those same exact questions in order to make sure that I was prepared to do the med pass with my patient. In the sim lab, I helped out by participating as I would play the significant other of the patient that the students were taking care of. And during the simulation, I would ask them questions. And then at the debrief, I would go over what they did well during the sim and what areas do they need to improve on. Overall, I really enjoyed working with the students. I found it to be really fulfilling and a lot of fun. But I also learned that I had to apply my knowledge from previous courses in order to help them. This objective was also met by my community service hours. I did some hours at the Daybreak Transitional Center in Allentown. This is a center where individuals that are either low income or they're homeless that can come to this center to receive food, showers, and different types of social services for to get medications, vaccines, doctor's appointments, or ways to help them to find a job. And with these individuals, I found that I was using therapeutic communication with talking to them because they just wanted someone to talk to about their emotions, their feelings, and I was using the skills of therapeutic communication, which I have learned from 309 and 313. The next objective is to apply the basic principles of ethics, management, and leadership to meet the needs of patients and their families. So this objective was met with the advanced practice portion. I spent the day with Kelsey Miller. She is a RN at Tower Health and a clinical nurse specialist. So she works in the oncology department at Reading Hospital, and with her, I saw a lot of examples of transformational leadership. She was very passionate about her job. She was very a big team player and just really inspiring. And she also really led by example. She would do rounds on the unit, check in with every nurse, make sure they were doing okay, and if they needed help, how can she help them? When we were doing rounds, there was a call bell going off, and she looked at me because no one else was answering. She says, "We're going to go answer that call bell and see if that patient needs anything." And luckily we did, because the patient was trying to get out of bed because he had to go to the bathroom and he was a fall risk. So with that, I saw a lot of examples of advocacy and then beneficence and non-maleficence, because she was causing, by answering that call right away and assisting the patient to go to the bathroom, we caused no harm. We also did what was best for him for care, because if we didn't answer that call bell, he would have fallen. And then she also explained her job is kind of like the middleman. Not only does she work with patients and families and the nurses, she also works with the administrators. When I was with her that day, she was doing a presentation to the administrators that I got to watch. It was about, she wants to create an icon and epic that would alert staff that a patient is on a medication that can pass hazardous materials through bodily fluids, urine, and stool. So with that, I saw advocacy not only for patient but also for the staff, so that they are also safe from potentially handling hazardous materials. The next objective is to evaluate the effectiveness of communication in promoting the optimal health of patients and their families. So with this, I saw an example of communication when I shadowed the nurse supervisors at Lehigh Valley Cedar Crest. There was an incident where I saw an example of upward communication where the bedside nurse called the supervisor to help her out with an incident she's having with a patient. There was some sort of miscommunication, and the patient was starting to yell in the room and being really rude to her. So to help to de-escalate the situation, she called the nurse called the supervisors to see if they could help her out. So we went down. We talked to the nurse first, and we figured out that the patient was refusing to leave even though she was ready for discharge. Like, she had her papers, her IV was out, but the patient was insistent that her scripts weren't ready for pickup. So the nurse supervisors, we went in to talk to the patient, and I saw examples of effective communication with the supervisor asking open-ended questions. They did a lot of listening. They allowed the patient to express her thoughts and her feelings about the situation, and we finally figured out that when the patient called the pharmacy to see if the scripts were ready, it was before the doctor even had a chance to have those scripts called into that pharmacy. So that's why there was some sort of miscommunication. So as a result, the supervisors called the pharmacy. They said they were ready for pickup. So we told the patient, but she was insistent that she called the pharmacy. So the supervisors allow her to do so instead of fighting her on it. And as soon as that patient called the pharmacy and they said they're ready, she was ready to go. So with that, I saw examples of not only like upward communication, but also just how to deal with conflict and what to do if there is miscommunication, and how can we effectively communicate with our patients. The next objective is to critically analyze and integrate leadership research findings into the total plan of care for a selected group of patients and their families. So with this objective, I found a research article that I will be presenting in post-conference. It discusses whether nurses are more likely to take a meal break if their supervisor is supportive of it. So the reason why the research article states reasons why nurses don't take regular breaks is due to job demands, understaffing, and not having the support from their supervisors. So with the research, they did a survey, and they found that nurses were more likely to take a meal break if the supervisor was supportive of it. Meal breaks allow nurses to have a reduce occupational stress and work-related illnesses, but also increase job satisfaction. So the way I interpret this article was that if a nurse is able to take a break, they can provide better patient care because they're not as stressed versus to a nurse that didn't take a break, and that could be more stress, more fatigue, more burnout. As a result, could make a mistake that could then affect patient care. So I think for supervisors, they need to collaborate with their nurses to figure out when are good times to take meal breaks, because it does have an effect on patient care. The next objective is to apply the principles of ethics, advocacy, and teaching to the everyday care of patients and their families. So with this objective, this was met when I did clinical hours at Good Shepherd Rehabilitation Hospital with the nurse supervisor, and there was an incident where a patient was requesting to switch rooms because at Good Shepherd they don't have a lot of private rooms. A lot of times they're semi-private, so usually there's 2 people to a room, and his roommate was at night keeping him up at night by like yelling and screaming and just being like very uncooperative with staff. So as a result, the patient asked his nurse, is there any way I can switch rooms? I'm not getting any sleep. So the supervisor, she was talking to the nurse about this. I saw examples of autonomy. We're respecting that for patient's autonomy, the right to switch rooms, because it does affect his health and his care. So with that, the supervisor assessed the situation. She's collaborated with the staff, and then they made it possible and safe-wise to switch rooms for that patient so that he could get sleep. And then I also saw like examples of like from the American Nurse the American Nurses Association Code of Ethics with Provision 3, which states the nurse promotes, advocates for, and protects the right and health and safety of the patient. By switching rooms, she was an advocate for that patient. He asked a reasonable request because he had a reasonable reason to switch rooms, and they were able to do so. And then with teaching, I did see an incident where a nurse was she was teaching the patient, you need to keep your helmet on. This was at Good Shepherd. She was teaching her patient, you need to keep your helmet on, and he kept taking it off because he had brain injury from a stroke. So each time he tried to take it off, she would come over and reinforce teaching, and that's how I saw how teaching can then take effect on patient care. The next objective is to formulate plans for continued personal leadership growth and development as an independent practitioner of nursing. So with this, I went to the presentation by Anita Sissy Green. She's a Cedar Crest College alum. She did a presentation about leadership and personal professional development, and she really stressed the importance of being true to your values and also to know your strengths and weaknesses, because even with your weaknesses, you can make that beneficial to you and make it work for you. So for example, for me, I'm quiet, and that can be seen as a weakness, but I try to turn that around to make it so that I'm a good listener. So Anita also stressed the importance of networking and having an inner circle that you trust. So with I would be definitely taking her advice and pointers from her presentation into my continued personal leadership growth. And then when I get my first nursing job, once I develop my skills and become more comfortable as a nurse, I would like to participate in committees. And I also like to pursue down the road, I would like to pursue higher education by getting a master's degree. The next objective is to recognize the role of the nurse in policymaking related to healthcare services at the local, state, national, and global levels. So with this objective, this was met with our field trip to Harrisburg, where we talked to our state representatives. So the first step nurses can do is to vote. And then the next step would be we need to talk to our representatives about policies that we want enacted and that we're passionate about. So one of them would be for Pennsylvania to join the Nurse Licensure Compact. So that will allow a nurse in Pennsylvania to get a license allow a nurse in Pennsylvania to not only get a license in Pennsylvania, but then she can also practice in other states that are part of the compact, versus right now in Pennsylvania, I have to have a Pennsylvania license. But if I want to go work in New Jersey, I have to get a New Jersey license. And then another way for nurses to be advocates is that we can actually run for government positions. We actually watched a video on Congresswoman Lauren Underwood. She's a state representative of Illinois, and she stressed she talked about how what she learned as nursing and the skills she developed has carried over into her job now, and how does it affect policymaking, and especially with healthcare, and how she's able to get bipartisan support. And then finally, the last objective is to predict and describe potential ethical dilemmas within clinical, organizational, professional nursing practice. So with this, for me, what I've noticed when I was at my clinical site for like patient logistics and nurse supervisor, there's a big issue right now with short staffing. Beds can't be filled because there's not enough staff to take care of those beds. When I was at the supervisor, I walked in, there was a 50 hold in the ER. So I think that would take an effect on patient care. But as for ethical dilemmas, that's an ethical dilemma with distributed justice. If we're supposed to give fair and equal care to these patients, how can I do that if I'm an ICU nurse and I have 5 patients on a ventilator? I can't give equal and fair care. That's nearly impossible if I don't have enough staff or resources to help me out with that care. And that will also take effect on nursing practice, because we're supposed to abide by our code of ethics. We're supposed to be advocate for a patient and provide quality care, because healthcare is universal. A person deserves healthcare, but how can I provide that if I can't give the same equal care because I have 5 patients in the ICU and I'm taking care of them mostly by myself with no aid or other nurses? So with me, I do think short staffing has really come to the surface, especially with COVID happening. That has really brought those problems to the surface, and I do think they need to be addressed or it's not going to get better. So that is the conclusion of my presentation, and I hope you enjoyed it. Thank you.